Oftentimes people don't see the point of this diabetic regimen. They don't see the point of restricting what they're eating, watching what they're eating. They don't think it's important to take their medications. There is a problem with diabetes in that you don't really feel bad with a high blood sugar. There's many, many people walking around with blood sugars at 2, 3, 4, even 500s. You learn, usually some of the signs and symptoms of a high blood sugar would be fatigue. But if you talk to anybody nowadays, everybody's tired. The life is just very hectic and very fast. Maybe you have to get up during the night to go to the bathroom several times, which also can add to the fatigue because now you're not getting a good night's sleep. Thirsty all the time, having to pass water fountains, every time you pass one, getting something to drink, carrying fluids with you all the time. Maybe you tend to catch colds or flus or different viruses a little more often because, again, when your sugars are out of control, you tend to not fight off infection as well. The problem is long-term that immediately those medications, again, help to lower your blood sugar. Long-term, the problem is the long-term complications, the blindness, the kidney disease, and the amputations. Again, the studies show that 76% of the time people were able to decrease or did not have those complications when they were able to maintain a normal blood sugar. So I guess it depends on what you want out of life. If you want to live a long, happy life and when you're 80, be able to still walk and see and take care of yourself versus being blind and on dialysis 4 hours a day, 3 days a week. It's kind of, again, like taking care of your car. You don't really need to change the oil. And if you decide to do it every 200,000 miles instead of the recommended 5,000 miles, at some point the engine's just not going to work as well. So again, that's a decision people have to make as to what kind of quality of life do they want.